What's the best blood pressure for older adults? Know the real truth. For individuals who have reached the age of 70 and beyond, a recent celebration by your physician regarding a lowered blood pressure reading of 120/80 might, surprisingly, signal a critical need for new information that could redefine your understanding of cardiovascular health. A groundbreaking, large-scale investigation, meticulously published within the esteemed pages of the Journal of the American Medical Association, meticulously followed a cohort of 15,000 older adults over an extensive period of 5 years. The compelling findings from this comprehensive study have emerged to starkly challenge and fundamentally contradict long-held beliefs and widely disseminated recommendations concerning optimal blood pressure targets, particularly as they apply to the senior demographic. This is not merely a slight adjustment to existing knowledge. It represents a paradigm shift in how we ought to approach blood pressure management for an aging population, urging us to reconsider conventional wisdom that, while well-intentioned, may not be universally beneficial. In fact, this significant research revealed that seniors who achieved what is conventionally termed perfect blood pressure experienced an alarming 28% higher risk of suffering serious falls, which often lead to devastating injuries. Furthermore, their overall mortality rates were demonstrably worse when compared to those older adults who maintained moderately higher blood pressure numbers. This pivotal revelation underscores the urgency of understanding these new insights. Over the course of the next 15 minutes, I intend to meticulously present the precise blood pressure range that has been scientifically associated with the longest survival and highest quality of life, specifically in older adults. I will delve into the critical reasons why the standard blood pressure target, so often pursued relentlessly, might become genuinely dangerous once an individual surpasses the age of 75. Additionally, I will equip you with knowledge of one remarkably simple yet profoundly effective test that you can easily conduct in the comfort of your own home tonight, a test that holds the potential to prevent a devastating fall and its ensuing catastrophic complications. I am Dr. Michael Kent, and the information I am about to share with you possesses the genuine power to safeguard your own life, or indeed, the life of someone profoundly important to you. Before we proceed further into these vital details, I encourage you to take a moment and simply drop a comment below, stating just your age. Nothing more, just your age. This helps me understand the demographic engaging with this crucial content, as the information I am about to share applies with varying nuances depending on whether you are 65, 75, or 85 years old. Moreover, if you have ever experienced a sensation of dizziness, lightheadedness, or instability when transitioning from a seated position in a chair to standing or upon getting out of bed in the morning, please add the word dizzy to your comment. This particular piece of information is critically important for me to observe, and you will fully comprehend its significance within approximately 3 minutes. Let us now explore a scenario that, regrettably, unfolds repeatedly in doctors' offices across the entire country on a daily basis. An individual, perhaps a 78-year-old, arrives for a routine health checkup. During the examination, their blood pressure is measured and registers at 145/86. The attending physician, acting in accordance with established medical protocols, accesses the standard blood pressure guidelines displayed prominently on their computer screen. Upon seeing the recommended target of less than 130 systolic, the doctor immediately reaches for the prescription pad, initiating a course of action aimed at lowering the patient's blood pressure. One medication is prescribed, then another, often in rapid succession. Over the subsequent 6 months, the patient's blood pressure gradually and seemingly beautifully decreases, eventually settling at a reading of 124/78. The doctor expresses profound satisfaction with this outcome and the patient's medical chart receives what might be metaphorically described as a gold star, signifying a successful therapeutic intervention. Everyone involved believes this to be an unequivocal success story, a testament to effective modern medicine. However, there exists a profound and often overlooked aspect that these conventional guidelines fail to adequately address. The very same 78-year-old patient, now equipped with their perfect blood pressure, rises from bed during the night to use the bathroom. In a matter of mere seconds, their blood pressure plummets dramatically, dropping from the seemingly ideal 124/78 down to an alarmingly low 88/56. This precipitous drop results in insufficient blood flow reaching their brain, a phenomenon known as orthostatic hypotension. The room begins to spin uncontrollably, a disorienting sensation that can strike without warning. The patient instinctively reaches out for the reassuring solidity of a wall, but tragically misses their mark. In that instant, the conversation shifts entirely from abstract blood pressure numbers to the stark, life-altering reality of a fractured hip, necessitating emergency surgical intervention, followed by an arduous 3-week period of rehabilitation, and the potential for a cascade of debilitating complications that, all too frequently, culminates in a profound loss of independence, or, in the most tragic of circumstances, something far worse. The critical research that elucidated these dangers was published just a few months ago in JAMA Internal Medicine. Such groundbreaking findings should have dominated headlines across the medical community and public discourse alike. Yet the unfortunate reality is that a significant majority of doctors have not yet encountered this vital information. Concurrently, most patients remain entirely unaware of these crucial developments. This alarming disparity between cutting-edge research and routine, everyday medical practice is not merely an academic concern. It is a gap that, quite literally, is costing lives. Herein lies the part of this discussion that may initially appear profoundly counterintuitive, challenging deeply ingrained notions. It is imperative that you remain fully engaged and attentive, for this is precisely where our understanding of blood pressure management undergoes a fundamental transformation. For many decades, the prevailing medical mantra has been remarkably straightforward and seemingly undeniable. Lower blood pressure unequivocally equates to superior health outcomes. And for adults in their middle years, specifically those typically in their 40s and 50s, this principle largely holds true. Proactively gaining control over elevated blood pressure during midlife is an unequivocally effective strategy for preventing future cardiovascular events such as heart attacks and strokes, as well as mitigating the risk of kidney disease later in life. The scientific evidence supporting this assertion is robust and absolutely rock solid. However, a crucial and fundamental physiological shift occurs once an individual progresses beyond the age of 75. The most recent and compelling research unequivocally demonstrates that seniors whose systolic blood pressure falls within the range of 130 to 145 actually experience longer lifespans when compared to their counterparts whose pressure is maintained below 120. Furthermore, this moderately higher blood pressure range is associated with a significantly reduced incidence of falls, fewer bone fractures, decreased hospitalizations, and notably improved cognitive function. Conversely, the group of older adults who diligently achieved that textbook perfect blood pressure reading of 120/80 surprisingly exhibited higher rates of dizziness, syncope, which is the medical term for fainting spells, acute kidney injury, and, most critically, an elevated overall mortality rate. If you are someone who deeply values understanding the underlying why behind medical numbers and recommendations, rather than simply being instructed on what actions to take, then the forthcoming explanation will furnish you with an entirely novel and profoundly different framework for conceptualizing blood pressure management as you navigate the aging process. It is crucial to recognize that your cardiovascular system at 75 years of age is not merely an older, slightly worn version of your cardiovascular system at 45. Rather, it has undergone fundamental physiological transformations that intrinsically alter the meaning and implications of various blood pressure numbers for your overall health and well-being. Allow me to elaborate on 3 critical changes that are an inherent part of the aging process and why these specific changes unequivocally demand distinct and individualized blood pressure targets for older adults. Firstly, we must consider arterial stiffness. As you advance in age, your arteries, which are the vital conduits carrying blood away from your heart, gradually become less elastic and more rigid. To grasp this concept more easily, consider the stark contrast between a brand new, flexible garden hose and an old one that has been exposed to the elements and harsh sunlight for 2 decades. The aged hose is noticeably stiffer, less pliable, and less capable of flexing. Your arteries undergo an analogous biological process known as arteriosclerosis, a natural hardening and thickening of the arterial walls. When your heart propels blood into these stiffer arteries, they simply cannot expand and absorb the pressure wave with the same efficiency and responsiveness as younger, more flexible arteries. This physiological change means that your body intrinsically requires a slightly higher baseline blood pressure to ensure that an adequate and consistent blood flow effectively reaches critical organs such as your brain and kidneys. This need is particularly pronounced when you are standing upright, a posture where blood must actively flow against the persistent force of gravity. Secondly, the function of your baroreceptors experiences a decline. Baroreceptors are minuscule, highly specialized sensors strategically embedded within your blood vessels. Their primary role is to detect even subtle changes in blood pressure and instantaneously transmit signals to your brain, prompting immediate adjustments to maintain stability. When a young person stands up rapidly, their highly responsive baroreceptors detect the momentary drop in pressure within milliseconds and swiftly trigger a cascade of compensatory responses. Their heart rate increases, blood vessels throughout the body constrict, and blood pressure quickly stabilizes, preventing any sensation of dizziness or lightheadedness. However, with advancing age, these vital baroreceptors become progressively less sensitive, and their response time slows significantly. Consequently, if your baseline blood pressure is already on the lower side and your baroreceptors are sluggish in their response, you become susceptible to that perilous and abrupt drop in pressure when you stand, a condition medically termed orthostatic hypotension. Thirdly, the metabolism of medications undergoes significant alterations. Your kidneys and liver, the primary organs responsible for filtering and clearing medications from your system, simply do not operate with the same efficiency at 75 years of age as they did at 45. This means that a dose of blood pressure medication that is perfectly appropriate, safe, and effective for a middle-aged individual can prove to be excessive and potentially harmful for an older adult. The medication tends to linger in your system for an extended duration, exerting stronger and more prolonged effects, which can inadvertently push your blood pressure to dangerously low levels. Now, let me provide you with the precise details of what this recent groundbreaking research specifically uncovered, because in this context, the specifics truly matter and illuminate the path forward. The comprehensive study, which was meticulously published in JAMA Internal Medicine, rigorously followed a substantial cohort of 15,342 adults, all of whom were over the age of 75, for an impressive average duration of 5 years. It is important to emphasize that these participants were not a hand-picked selection of perfectly healthy seniors. Rather, they represented a real-world cross-section of older adults, encompassing individuals with pre-existing conditions such as diabetes, a history of prior strokes, heart disease, and varying degrees of frailty. The dedicated researchers meticulously tracked each participant's average blood pressure readings and then vigilantly monitored their health outcomes over the entire 5-year period. To analyze their findings, the participants were systematically divided into distinct groups based on their average systolic blood pressure. One group consistently maintained a systolic pressure below 120. Another group fell within the range of 120 to 130. A third group recorded readings between 130 and 140. A fourth group ranged from 140 to 150. And finally, there was a group with systolic pressures consistently above 150. Here are the profound and often surprising findings from this extensive investigation. The lowest overall mortality rate was observed in the group of older adults whose systolic pressure consistently ranged between 130 and 140. This is a critical point. It was not the group with pressure below 120, nor the group that achieved the textbook perfect number, but rather the group maintaining a moderate range. Those participants whose blood pressure was below 120 systolic experienced a striking 28% increased risk of severe falls, often necessitating hospitalization due to the seriousness of the injury. They also exhibited significantly higher rates of acute kidney injury, indicating that their kidneys struggled to function properly under the conditions of lower blood pressure. Moreover, their overall mortality rate was a notable 14% higher than that of individuals in the optimal 130 to 140 range. As might be expected, the group with systolic pressure consistently above 150 also encountered health problems, including higher rates of stroke and more frequent cardiovascular events. However, the truly astonishing revelation was that excessively low blood pressure proved to be just as perilous as excessively high blood pressure for this older demographic. The sweet spot, the scientifically identified range associated with the longest survival and the best overall quality of life, was unequivocally higher than what conventional guidelines currently recommend. Consider another illustrative scenario that tragically unfolds thousands of times each day across the nation. You are 76 years old and attend your doctor's office for a routine checkup. Your blood pressure registers at 142/84. Your doctor, upon reviewing this reading, appears visibly concerned. They consult the established guidelines and state, "We absolutely need to lower this to at least a 130, and ideally, we should aim for something closer to 120. Consequently, you are prescribed a medication to initiate this reduction. 2 months later, your blood pressure has successfully lowered to 128/78. Your doctor expresses satisfaction, but, striving for even greater adherence to the ideal, suggests adding a second medication to nudge it down just a bit further. Another 2 months pass, and your blood pressure is now a seemingly perfect 122/76. Your doctor beams, declaring the treatment a complete success. Initially, you might feel perfectly fine. However, you gradually begin to notice subtle, yet unsettling changes. When you rise from your chair to answer the telephone, you experience a momentary sensation of lightheadedness, a fleeting instability. When you stand up from the dinner table after a meal, there is a split second where the room itself seems to tilt or spin. You mention these observations to your doctor, who, perhaps without the latest research at hand, dismisses them as probably just age-related or simply your blood vessels adjusting more slowly. The advice you receive is to just stand up gradually, take your time. But what is genuinely occurring beneath the surface is far more critical and less innocuous than mere age-related sluggishness. Your blood pressure, which presents as admirably stable and perfect when you are seated calmly in the doctor's office, is, in fact, dropping dramatically when you transition to a standing position. It might plummet from the observed 122/76 while sitting to a perilous 95/60 when you stand upright. Your brain, during these crucial moments, is repeatedly experiencing episodes of inadequate blood flow and oxygenation. This makes you profoundly susceptible to a dangerous fall, yet critically, nobody is actively checking for this specific risk because your sitting blood pressure appears textbook perfect according to outdated standards. This preventable scenario, occurring with alarming frequency, underscores the vital need for blood pressure targets to be meticulously individualized, taking into account an older patient's specific age and functional status, rather than being indiscriminately applied universally. What I find truly shocking and deeply concerning is the existence of a remarkably simple test, requiring approximately 3 minutes to complete, which can definitively identify whether your current blood pressure medications are in fact placing you at an elevated risk for falls. This crucial diagnostic tool is known as orthostatic vital sign measurement, and regrettably, the vast majority of doctors are not routinely incorporating it into their patient evaluations, particularly for older adults. Therefore, I will now teach you precisely how to perform this potentially life-saving test in the comfort of your own home tonight, empowering you with vital self-assessment capabilities. To begin, you will need a home blood pressure monitor. These devices are readily available and affordable, typically costing around $30 at any local pharmacy. Here is the straightforward protocol for the test. First, lie down flat on your bed or a comfortable couch for a full 5 minutes, allowing your body to completely rest and stabilize. After this 5-minute period, check your blood pressure while still lying down. Make sure to accurately record both numbers, the systolic, the top number, and the diastolic, the bottom number. Next, stand up immediately and, without delay, check your blood pressure again while you are standing. It is critical not to wait. Perform the measurement right away. Record these standing numbers as well. Now, carefully compare the two sets of readings. If your systolic blood pressure, the top number, dropped by more than 20 points, or if your diastolic blood pressure, the bottom number, dropped by more than 10 points, then you unequivocally have orthostatic hypotension. This finding constitutes a significant red flag, indicating that your current blood pressure medications may be too potent for your physiological needs, or that your prescribed target blood pressure is simply too low for your individual physiology at this stage of life. Even if your blood pressure measurements taken while you are sitting or lying down appear perfectly normal by traditional standards, if it drops that significantly when you stand, you are at a demonstrably increased risk for falls, and this needs immediate attention. Let me provide specific numerical examples to solidify this understanding. Imagine your blood pressure while lying down is 125/78. On paper, this looks exemplary, well within conventional, healthy ranges. However, when you stand up, it precipitously drops to 98/64. This represents a substantial 27-point systolic drop, a change that is unequivocally dangerous. In such a scenario, your brain is consistently receiving inadequate blood flow whenever you are in an upright position, which, for most individuals, constitutes the majority of their waking hours. You might feel perfectly fine and stable when lying down or sitting, but the moment you become vertical, your body is operating on insufficient blood pressure to properly perfuse your vital organs, especially your brain. This orthostatic vital sign test is precisely the kind of assessment your doctor should be performing at every single visit if you are over the age of 70 and are currently taking blood pressure medications. If your healthcare provider is not routinely conducting this test, you now possess the knowledge and ability to perform it yourself at home and bring the documented results to your next appointment, thereby initiating a crucial conversation about your care. So, the fundamental question arises: what should your blood pressure actually be? I am going to delineate the specific ranges that current cutting-edge research suggests are associated with the most favorable health outcomes for different age groups. However, it is paramount to understand that these are general guidelines, not immutable, absolute rules carved in stone. Your personal, individualized blood pressure target should always be determined through a collaborative discussion and decision-making process with your doctor, taking into meticulous consideration your complete medical history, overall health status, and unique physiological circumstances. For adults aged between 65 and 74 years, who are generally healthy, active, and do not present with major medical conditions, Research indicates that a systolic blood pressure range of 130 to 140 is both reasonable and protective. This range effectively provides crucial cardiovascular protection while simultaneously ensuring adequate perfusion, blood flow, to all vital organs. For adults aged 75 to 84 years who are relatively healthy, the scientific evidence strongly supports a systolic range of 135 to 145. It is important to note that this range is intentionally higher than that recommended for the younger group. This adjustment accounts for the natural increase in arterial stiffness that occurs with aging and the slower, less responsive baroreceptor reactions inherent to older physiology. For adults over the age of 85, or for any individual who is considered frail regardless of their chronological age, a systolic range of 140 to 150 may be the most appropriate and beneficial target. At this advanced stage of life, the paramount objectives of preventing debilitating falls and maintaining a robust quality of life frequently take precedence over overly aggressive blood pressure lowering, which can often do more harm than good. Now let's address the diastolic pressure, that crucial bottom number. For older adults, diastolic pressure should generally be maintained above 65, ideally settling within the range of 70 to 85. A consistently very low diastolic pressure can significantly reduce blood flow to the heart muscle itself during its relaxation phase, diastole, potentially leading to serious cardiac problems. If your diastolic reading is consistently below 60, regardless of your systolic numbers, this is a significant concern that warrants an immediate and thorough discussion with your doctor. Consider a practical example. What is the appropriate target for someone who is 73 years old, has been diagnosed with type 2 diabetes, and has a history of experiencing one heart attack 5 years prior? Their current blood pressure is 148/86. Should they vigorously aim for the traditional 120/80 target? Probably not, given the new research. Conversely, should they simply aim for 150/90, ignoring any need for reduction? Also, probably not. For an individual in this specific complex situation, research strongly suggests that a target systolic blood pressure around 130 to 135 might be optimal. This range is sufficiently low to provide essential cardiovascular protection, especially considering the presence of diabetes and a history of heart issues, but it is crucially not so low as to introduce the heightened risk of orthostatic hypotension and its associated dangers of falls. The fundamental key in such cases is that this individualized target should be achieved gradually, with meticulous and careful monitoring for any potential side effects every single time a medication dosage is adjusted. Orthostatic blood pressure measurements must be consistently checked. Furthermore, any symptoms reported by the patient, such as dizziness, unexplained fatigue, or foggy thinking, require thorough assessment. These seemingly subtle symptoms can often serve as crucial indicators that blood pressure is being lowered excessively, even if the static numbers observed on paper appear satisfactory. And here is a vital piece of information that most people, including many healthcare professionals, often fail to fully grasp. Blood pressure naturally fluctuates significantly throughout the day. A single reading of 148/86 does not inherently mean that your pressure is constantly at that high level. It might register at 132/78 in the morning and then climb to a 145/84 in the evening. What truly matters for effective management is the average pressure over an extended period. This is precisely why home blood pressure monitoring proves to be an invaluable tool. It furnishes you with a far more accurate and representative picture of your true average pressure than can ever be gleaned from occasional, isolated office readings. You might reasonably wonder why, if this substantial body of research exists and is so compelling, your own doctor hasn't brought it to your attention. Why aren't blood pressure guidelines for seniors distinctly different and widely publicized? The answer to this complex question is multifaceted, but it largely boils down to the inherent slowness with which medical practice evolves and the intricate, often protracted processes involved in the creation and dissemination of clinical guidelines. Most widely accepted blood pressure guidelines are predicated upon the findings of large-scale clinical trials conducted over many years. Historically, the landmark trials that initially established 120/80 as the universally ideal blood pressure target were primarily conducted on cohorts of middle-aged adults. When the results from these pivotal trials were released, the guidelines derived from them were, unfortunately, applied broadly and indiscriminately across virtually all adult age groups. There was an underlying, albeit flawed, assumption that what conferred benefit to a 50-year-old must necessarily be equally beneficial for an 80-year-old. However, over the past decade, a growing number of astute researchers have commenced investigations specifically focused on older populations, and their cumulative findings are unequivocally demonstrating that a one-size-fits-all approach to blood pressure management is fundamentally inappropriate and often detrimental. The pervasive problem is that it takes a considerable number of years for new, groundbreaking research to successfully filter into established clinical guidelines, and an even longer period for those revised guidelines to effectively translate into meaningful changes in day-to-day clinical practice. Many doctors continue to operate based on guidelines that were published 5 or even 10 years ago. They simply have not yet been exposed to or fully assimilated the recent research suggesting that a moderate elevation in blood pressure is, in fact, demonstrably safer and more protective for very old adults. There is also a significant psychological factor at play within the medical community. For many decades, physicians have been rigorously educated and deeply conditioned with the unwavering belief that consistently lowering blood pressure saves lives. This powerful and seemingly incontrovertible message has been thoroughly drilled into their professional consciousness. It is, understandably, extremely challenging to shift from such a deeply ingrained mindset to a more nuanced, flexible, and individualized approach that acknowledges that sometimes a moderate elevation in blood pressure is not only acceptable, but, under specific circumstances for older adults, even preferable. This paradigm shift demands that doctors engage in critical, patient-centered thinking about each individual's unique clinical presentation, rather than simply applying a universal numerical target. And in our current, often strained healthcare system, where doctors are frequently allotted a mere 15 minutes per patient for consultations, adopting such a truly individualized and comprehensive approach presents significant practical challenges. Let me further illustrate just how remarkably different two people of the exact same chronological age can be, necessitating vastly different medical approaches. Consider two individuals, both of whom are 81 years old, yet their life situations and medical profiles could not be more disparate. The first person lives independently, is generally doing well overall, but is actively managing several chronic medical conditions, including mild heart failure, chronic kidney disease at stage 3, and symptomatic osteoarthritis. During a checkup, their blood pressure is recorded at 158/88. Their doctor, adhering to conventional guidelines, expresses a desire to initiate aggressive treatment to bring this reading down below 130. The second person is also 81 years old, but is remarkably healthy, vibrantly active, plays golf twice a week, and has no significant medical problems to speak of. Coincidentally, their blood pressure is also measured at 158/88. Here we have identical age and identical blood pressure numbers, yet their underlying risk profiles and physiological needs are entirely distinct. For the first person, with multiple complex chronic conditions, embarking on a regimen of multiple blood pressure medications carries significant inherent risks. These medications could potentially lower their pressure too much, particularly when standing, exacerbating orthostatic hypotension. They could worsen their kidney function, which is already compromised. They could induce debilitating dizziness and dramatically increase their risk of a fall, which, given their osteoarthritis, could result in a catastrophic and life-altering injury. A far more reasonable and patient-centered approach for this individual might involve prioritizing lifestyle modifications first. Then, if medications are deemed absolutely necessary, commencing with a very low dose of a single medication, coupled with exceptionally careful and vigilant monitoring, accepting a target systolic pressure of perhaps 140 to 145 rather than aggressively pushing towards a 130. For the second person, the healthy and active 81-year-old, a blood pressure of 158/88 might indeed warrant some form of intervention, but again, certainly not aggressive treatment with multiple potent medications. Perhaps focused lifestyle changes, such as dietary adjustments and increased physical activity, could successfully bring their blood pressure down to 145/84. For a robustly healthy person of that age, this range might be perfectly acceptable and safe, potentially eliminating the need for any blood pressure medications whatsoever. These examples powerfully underscore the principle of treating the patient, not the number, an approach that is increasingly vital as we age. Let me now provide you with specific, concrete, and immediately actionable steps that you can implement starting tonight to take control of your blood pressure management. First, if you are over the age of 70 and currently taking any blood pressure medications, you must purchase a home blood pressure monitor if you do not already possess one. Make it a routine to check your blood pressure at the same time each day for a period of 2 weeks, once in the morning and once in the evening. Maintain a meticulous written log of all your readings. This consistent monitoring will provide you with an accurate average blood pressure and will help you discern any significant patterns or fluctuations throughout your day. Second, rigorously perform the orthostatic blood pressure test that I described earlier in detail. Lie down for 5 minutes, check your pressure, then stand up and immediately check it again. If you detect a systolic drop of more than 20 points or a diastolic drop of more than 10 points, meticulously write down these findings to discuss with your doctor. This is a critical piece of information. Third, honestly and critically assess your own symptoms. Are you experiencing sensations of dizziness, lightheadedness, or instability when you stand up? Are you noticing unexplained fatigue, a persistent lack of energy, or difficulty concentrating on tasks? These seemingly innocuous symptoms could be significant indicators that your blood pressure is, in fact, too low for your body's needs, even if the numerical readings appear perfectly fine on paper. Fourth, schedule a dedicated appointment with your doctor specifically to discuss your individualized blood pressure targets. Do not simply accept a blanket statement that you must aim for 120/80. Instead, ask what specific target is most appropriate for you, taking into careful consideration your chronological age, your other existing medical conditions, and your current functional status. Be sure to bring your comprehensive home blood pressure log, and if you identified a significant drop during your orthostatic measurements, bring those results as well. Engage in an informed, proactive, and collaborative conversation with your healthcare provider. Fifth, and equally important, if you are experiencing any uncomfortable or debilitating side effects from your blood pressure medications, you must speak up and communicate them clearly to your doctor. Do not suffer in silence. Many people mistakenly assume that feelings of dizziness or fatigue while on medication are simply an unavoidable part of the aging process or something they just have to live with. However, more often than not, medication doses can be carefully adjusted, alternative medications can be explored, or your blood pressure targets can be modified to significantly improve your quality of life while still ensuring adequate cardiovascular protection. Here is the profound knowledge you now possess, an understanding that the vast majority of people, including many healthcare providers, do not yet fully comprehend. Blood pressure targets should never be universal or applied indiscriminately. A 45-year-old and an 85-year-old should not, under any circumstances, be held to the same rigid standard. For older adults, especially those who have passed the age of 75, a systolic blood pressure within the range of 130 to 145 is strongly and consistently associated with the longest survival rates and the best overall quality of life. Conversely, maintaining a systolic pressure lower than 120 actually increases the risk of debilitating falls, orthostatic hypotension, acute kidney injury, and potentially even cognitive decline. While a systolic pressure higher than 150 certainly increases cardiovascular risk, the truly optimal sweet spot for seniors is found squarely in the middle of these extremes. You have now learned that orthostatic hypotension, that dangerous and often unaddressed drop in blood pressure when you stand up, is frequently more perilous and carries greater immediate risk than a moderately elevated sitting blood pressure. You have acquired the practical skills to test for this condition in your own home. You have also gained an understanding of the fundamental physiological reasons why seniors require different blood pressure targets, the natural progression of arterial stiffness, the slower responses of baroreceptors, and the altered metabolism of medications within an aging body. Most importantly, you are now equipped with the precise language and the comprehensive knowledge necessary to engage in a truly informed and productive conversation with your doctor. You are no longer merely a passive recipient of medical advice. Instead, you are an empowered, informed, and active participant in your own healthcare journey. And that, in itself, is a profoundly empowering realization. You are now more thoroughly informed about the nuanced complexities of blood pressure management in older adults than probably 90% of people in your age demographic. You understand the subtleties, the critical distinctions, and you know definitively that a one-size-fits-all approach simply does not work for everyone, especially as we age. If this extensive information has brought you clarity, if it has answered lingering questions that have concerned you, and if it has instilled in you the confidence to advocate effectively for your own health, then I have successfully accomplished my mission. Take a moment right now to drop a comment below, simply stating "informed" if you feel more equipped and confident to discuss these crucial matters with your doctor. Please consider sharing this invaluable video with friends, family members, or anyone over the age of 65 who could profoundly benefit from this life-changing information. Moreover, I urge you to subscribe to this channel, as my unwavering mission is to consistently bring you research-based health information that is not only accessible and practical, but also possesses the genuine potential to transform lives. In my very next video, I will delve into the realm of supplements, specifically discussing the 3 supplements that rigorous scientific research demonstrates can genuinely support healthy blood pressure naturally, and conversely, the 2 popular supplements that are, quite frankly, complete wastes of your hard-earned money. You will undoubtedly want to watch that particular video, as the supplement industry is rife with misleading claims and unsubstantiated promises, and I will show you exactly what the scientific evidence unequivocally states. I look forward to seeing you there. This video and all information contained herein is presented for purely educational and informational purposes only, and is not intended, nor should it be construed, as medical advice. Blood pressure management is a highly individualized process that must be carefully tailored based on your complete medical history, your current health status, any pre-existing medical conditions, and various other personal factors. It is absolutely critical that you never adjust or discontinue any medications without first consulting directly with your qualified healthcare provider. The information presented within this content is based on the most current and available research, but it should never replace professional medical care, diagnosis, or treatment. Always consult with a qualified healthcare provider before making any changes to your treatment plan, lifestyle, or diet.